When assessing joint range of motion, we're looking for two things, of course: quantity of range of motion and quality of range of motion. And the main reason I apply overpressure at the end range is to get those final degrees of motion. But I'm not only assessing for how many more degrees can it go when we give some external force, or is it painful or symptomatic. I'm also assessing for the end feel. End feel is a term we use in orthopedics to describe how it feels when the joint goes as far as it can go. And it's something that's largely perceived by the clinician when the force is applied. There are three main categories of end feels: soft end feels, firm end feels, and hard or bony end feels. As an example, let's take the elbow joint. It has four primary planes of motion: elbow flexion, extension, supination, and pronation. And when we go into elbow flexion, for example, and I apply some overpressure to the distal forearm to get it to flex as far as it will go into end range, the end feel is a soft end feel, because what's stopping the joint from flexing more is the soft tissue. The tissue of the forearm is approximating the tissue of the arm and preventing the joint from flexing further. And that's not pathological. That's the normal end feel for elbow flexion. In contrast, elbow extension, when we straighten the arm all the way and apply some overpressure to get to end range, the end feel in that case is a bony or hard end feel, because the reason the elbow can't straighten anymore is because the bones are stopping it. So there's soft end feels and hard or bony end feels, and then there's firm end feels, which usually means that the ligament is stopping the motion from proceeding further, muscular tension, or capsular tension. And again, these are normal end feels for each joint in each plane of motion. And so if I'm assessing again for that end range motion by applying some overpressure, if I feel a type of end feel that is not supposed to be the case, then that can help with the diagnostic process. So we always want to understand how far a joint goes, what it feels like, and that end range should be within the normal limits of what that end range should be in terms of how it feels. It should be either normally soft, firm, or hard, and when it's not, we need to note that and think about how it informs the diagnosis.